She was an 8-year-old having a dental cleaning under anesthesia, and she died. She was a beautiful girl, absolutely devastated the family. This isn't one or two children once every 10 years. This is way, way more than that.
With my mentor, Dr. Steve Duffin, we treated hundreds of kids on a study in Bolivia. And I'm telling you, almost every single one of those in this country would have been a hospital case. But we used this medicine on all of them a couple of times. And 6 months later, we went back and the vast majority, all the pain was gone.
My grandchildren, nobody has a cavity, nobody has a lost tooth, nobody's going to have a wisdom tooth out.
And then the other thing that parents think is, you got a cavity, you got to go get a filling. You got to go get it drilled and filled. That is the last possible resort.
I know it's hard to calculate for both of you. How many people you think you've supported throughout your careers?
To me, it's impossible to say because families get on board and families tell families. I know that I can make a YouTube video today and people will come on saying, I've been using Dr. Ellie's system for 15 years, for 13 years, for 8 years. It's wild and it's wonderful. That's why I keep doing it.
Hi, I'm Cristian. I'm not a dentist, but I'm a dev. I followed Dr. Ellie's work for years and deeply admire how she challenges the system and empowers parents with honest, sometimes uncomfortable truths. Because if there's something out there that could save even one child's life, we need to talk about it. And with this, I want to welcome Dr. Chris and Dr. Ellie. Dr. Ellie, I know that your audience knows you and you've probably shared this in the past, but just for purposes of the context of this conversation, could you share briefly what is your trajectory in the decades that you've been practicing medicine, where you've practiced, and around how many people have you helped?
I began in 1970. I worked in Switzerland first and learned a lot about nutrition and oral health. And I was able to take the information I learned in Switzerland in my first job and translate it into England. I was using a medicine and keeping it very simple and very quick and effective. When I came to America, they were actually doing root canals and crowns and taking children into the operating room in the hospital. And it was completely different approach from that approach that I'd been using in England. What I came to find out is that there are two ways of operating in dentistry. One is to do cosmetic dentistry, as it were, on children, and the other is to simply deal with the issues in the least invasive way.
Dr. Chris, I'm super excited to have you here. And for people who are listening right now who don't know who you are, could you share what is your expertise? How many decades you've been doing this? What are your studies? And how many people you've helped?
Sure. I have been in dentistry for 40 years. Throughout my career, I have had a passion for how progressive dentistry can be. I didn't want to sit in the past. There have been many things that come into dentistry that have improved lives and made us healthier. My passion is how the mouth health can keep our whole bodies healthy. So I've lectured on that all over the country. I also have learned that there are medicines that we can use to treat tooth decay without a drill. And I've lectured on that all over the country and to hygiene associations on webcasts. And I've been doing that for all this time. What I'm doing basically is telling everybody what the American Dental Association is recommending, but they don't mandate anybody to do it. It's a wonderful conservative kind of care, very healing. And I'm so excited about it. That's what I talk about now. And like I said, I have had articles on this in national dental magazines. I have given lectures on this.
I know it's hard to calculate for both of you. How many people you think you've supported throughout your careers?
To me, it's impossible to say because families get on board and families tell families. I know that I can make a YouTube video today and people will come onto that comment saying, I've been using Dr. Ellie's system for 15 years, for 13 years, for 8 years. These are people, where did I meet them? At the airport and in my office, online. I used to do coaching. I have no idea. And they come into my life. There are people in England. There are people in Australia. It's wild and it's wonderful. And I love to hear the comments from people that I helped. That's why I keep doing it. It's the same reason Dr. Chris does what he does. If you save a life or you save someone's oral health, you have no idea what you might have saved them from.
I'm so excited to talk with both of you and to start just focusing the conversation that we have today. I'd love to ask, I'll start with Dr. Chris, if you could share what are the risks of dental anesthesia for kids that most parents never get to hear about?
When you talk about dental anesthesia, there's two different types. The one that brought us all together is the sedation, the deeper sedation type, where you get put to sleep to have your dental care. That's what really scares us the most. Fortunately, I'm in a dental practice where I haven't given anybody a shot in 5 years because of the type of care that I do. I think the question that you asked is, there's a risk when you sedate somebody. And why do children get sedated? Because they're full of energy and they're full of fear, and they don't want to necessarily go to the dentist, and they're hard to work on. General dentists don't want to work on children, and they usually just pass them off to a specialist. And if the specialist feels they're too much trouble, then they'll say, I can't treat this child in my office. They have so much going on and they're so difficult to treat. We need to sedate them and either do it in a hospital, or some dental offices will do the sedation right in their office. So that's why lots of kids get sedated. I learned the stats of how many sedation cases were done in one state. I tried to figure out what on the average there might be on any given workday in America. And 1,000 kids may be sedated either in a hospital or in a dental office for their dental care. And there are inherent risks in that. And I think a lot of parents, they just think, oh, it's done by an expert, it must be okay, and everything's fine. But there are challenges. There's developing brains in young kids. They're more at risk for their heartbeats changing, for their breathing changing. And with those changes under deep sedation, in other words, hospital lights out, kind of, you're not conscious, they get them into that state so they can do lots of dentistry.
I've heard that there's conditions such as sleep apnea, asthma, and other factors, allergies that parents may not know about that make that procedure riskier. And Dr. Ellie, I know that you dedicated a book to a child who died. You've been very passionate about this subject. Could you share from your perspective, what are the risks of anesthesia that parents don't know about?
My book was the first edition of Kiss Your Dentist Goodbye, which was, I just released a new edition, but the first edition was dedicated to the family of Raven Blanco, who was an 8-year-old from Chesapeake, Virginia. And she was having a dental cleaning, Dr. Chris. She was an 8-year-old having a dental cleaning under anesthesia. I believe she had a sickle cell trait that caused some sort of change in blood oxygen, and she died. And to me, this was heartbreaking. She was a beautiful girl, absolutely devastated the family. And I was at that time trying to get the word out about xylitol and how xylitol will loosen plaque, and with correct brushing, you don't have to have plaque on your teeth. It is so preventable with delicious little tiny amount just before you go to bed at night and a couple of other times during the day. Why is a child's life disappearing like that over dental cleaning? That's why I dedicated the book to her, because I couldn't come to terms with it. I was so upset, and I'm still upset. And I was told that many of these cases do not come to light. The public is not aware of the laundry list. And it is a list. I hate to put it in those terms, but this isn't 1 or 2 children once every 10 years. This is way, way more than that. And this particular tragedy occurred in 2007. And I believe it may be getting slightly better now, but certainly in the 2016, 2017, 2019, it was out of control. There was a beautiful little girl here in Austin, Texas, Daisy. And I'm always cut up about this because I'm a mother of 5. I had beautiful little daughters and a little son. If those children had been in those shoes, I can't imagine.
I heard, as I was doing research for this, that there's many cases that don't see the light of day for the public because these insurance companies are settling out of court. And with those settlements, there's confidentiality clauses that prohibit them from talking about it. So the percentage of cases that we hear about is only a small number of them, because in order for them to get the money, they have to sign paperwork that they cannot discuss this openly. I'm also a parent. I love my children. I cannot envision a more tragic trauma for a family that doing something that they thought was in the benefit of the child and then the child have no say in it, and then they don't walk out alive from the office. Are there any other factors that you think are into play as to why people don't know about this?
I believe that dentists are trained. That was my issue when I came to America. I look at it now and I just see that dentists are trained in this format. They believe in it. They don't even know. Dr. Chris, you can expand on that. I was the clinic director of the pediatric clinic at the University of Rochester, and we would take in 14 students into the clinic, training them every 2 years in this 2-year program. And I don't believe they had any clue about an atraumatic restorative option that was something they could even choose to do. They were trained in this blueprint, and they believed that there was no other way. And is that correct?
Yeah, it's complicated. Dentistry, it's a conservative group of people, and they can stand behind the training they received in college and the tests they had to pass their boards to get their license. In many states, they didn't even have to take any more new education for a long time. That has changed, but that was recent. So some people were practicing dentistry the way they did it many years ago, and yet things have been changing all along. The profession of dentistry is being built upon the traditional ways it's always done things, which is amputate the disease. If you had strep throat and your doctor said, wow, you got a bacterial infection in your throat there, let's cut that throat out and that's how we'll get rid of that infection. Tooth decay is a bacterial disease. Yet dentists for 100 years continue to amputate the tooth structure when they know or should know that it can be healed, that you don't have to amputate it. You can use a medicine on it called silver diamine fluoride, and there are others that can heal, that can kill the bacteria and heal the softened tooth structure. But it doesn't fit the business model of dentistry. So maybe not a lot of people want to even look into that. It's like, wow, they taught me how to drill teeth in dental school. I had to drill teeth to get my license. I had to buy all these drills and all this equipment. And yet in this line, in this new lane, it may not be necessary or as necessary as most dentists feel it is. So I'm just living proof that once I dropped the drill and chose to treat teeth medicinally, I have not sent one patient to the hospital for their dental care. And with a group of people, with my mentor, Dr. Steve Duffin, we treated hundreds of kids on a study in Bolivia. And I'm telling you, almost every single one of those in this country would have been a hospital case, a deep sedation hospital case. Yet we saw child after child with very severe tooth decay and tooth pain. But we used this medicine on all of them a couple of times. And 6 months later, we went back and the vast majority, high 90s, we'd still halted all of the decay without ever doing the drilling and filling thing, no hospital need, and all the pain was gone. So if that isn't a miraculous, paradigm-changing, disruptive kind of dentistry, I don't know what is. And when you experience that, and I've been experiencing that in my practice for 5 years, it became very clear to me, being on this study with Dr. Duffin, that this has got a place worldwide for care. It's so kind and humane and simple, and that's why we need to be talking about it. Inexpensive, no tears, no crying. Kids don't have the trauma. The only kids that cried when we saw the 200 in Bolivia were kids that had previous dental appointments, meaning they already had the bad experience that may stay with them anytime they get into that situation again. Those were the only ones. Otherwise, you saw kids happy, opening their mouths. We put a little medicine on there, smiling, happy.
I believe deeply that people go into dentistry because they want to help. It's a difficult profession to get into. There's a lot of years of study. People get in because they really, truly want to have a benefit for society. But you have the goodwill of doctors. You have traditional industry that benefits from having procedures that are costly, that are, I would say, antiquated, like things that don't work. And I can think of examples in different industries, right? For decades, the tobacco industry was funding research projects that would say that tobacco was actually good for you. And for years, people who were in the sugar industry were also in the 60s pushing, again, programs saying that sugar was good for you, that it was fat that was making people fat. And the opioid epidemic in the United States also is from companies that were pushing these drugs that were at the very end making people sick, making people addicted, and having people overdose. So we see example after example on different industries where until people don't understand the truth, nothing changes. I don't want to say that the dental industry is just like this. I want to give these examples because people need to understand that this happens all the time. But from your point of view, what are the points of inflection in the dentist industry that are making sure that just stays the same?
Coming into America as an experienced dentist, after 12 years of dentistry, I chose to take a pediatric specialty at that moment. And I was there with my 12 years, but everyone else had just left dental school. And when I questioned things, it was so interesting. Nobody really wanted to listen to me. I couldn't understand, why wouldn't you listen to a 12-year dentist? They believed that breast milk causes cavities. And I'm saying no, but they had been trained in a particular way. I felt redundant. And I would tell them, can I show you how to give a pain? In those days, I was trying to explain to them how to give a painless injection, which is something I had studied. There was no interest. They didn't want to learn something new. They were doctor qualified and they wanted to carry on. And they were too immature and new in the field to understand what I was saying. It was as if they were deaf to me. And I found it very distressing because there were so many things I wished I could have taught them. Now, where did I learn that? I learned it because I apprenticed. I became an apprentice first to a Swiss dentist. And they trained me in all the things that they had learned over the years. So you get this accumulation of knowledge by apprenticeship. And I think you get every new dentist is a new trainee let loose on the public. I feel like we need to go back where maybe an experienced dentist like Chris takes a young dentist out to Bolivia there are plenty of places in America where we have out of control tooth decay in rural areas, and to show them how this is. Once you've seen it in real life, big, huge problems dealt with, that you can never undo. But you can never tell somebody something they haven't seen.
Dr. Chris, in your experience, what are the factors in the dental industry, I would say industry complex, that are preventing people from making these solutions and these risks widely known? Who is benefiting from not changing things?
It seems like it is the status quo to keep doing things the way they've always been doing it in the profession. If we've been doing it for 100 years, it must work. At least it's been working for 100 years. How do you affect change? Ellie and I wanted to affect change in terms of how people view mouth health, how it contributes to body health. We started our own organization, okay? You would look to the American Dental Association and say, they should be touting this. They should be talking about this. And they are. However, they are beholden to all kinds of members. They can't do a mandate. They can't say anybody's got to do this, treat teeth conservatively with these medicines, although they do say, and every microbiologist and dental cavity scientist in the world would say that the dental drills do not kill the cavity-causing bacteria that's in the mouth. They don't. So you can put a filling in, but you're still going to be in trouble. So the ADA at least acknowledges that's not the answer. Furthermore, they recommend prioritizing a non-restorative approach. So I love the ADA for this stance. And they make guidelines as to how we should approach cavities, and that our first consideration should be a non-restorative approach, which is either preventive care or it's either this SDF healing kind of care, but it's not using a drill where you'd have to cut out and amputate tooth structure and then fill it and then cross your fingers and hope you won't have to do that again in 6 or 7 years. But darn it, that's what seems to happen over time. The fillings fail because the ADA said, they're saying you can't control the bacteria. You can't with the drills and the fills. So there's more that we can do. So anyway, they're caught in the middle because they're the organizational body of dentistry, main one, love them for their stance on these things. They got to be everything to everybody. And that's the hard part. Whereas AOSH, the American Academy for Oral Systemic Health, we didn't have to worry about somebody poo-pooing that, oh, the mouth health doesn't affect the body health. You guys are nuts. So say whatever you want. We're going down this lane. We're going to promote it. We're going to teach about it. We're going to show all the studies that make it real. And that's the same thing that we want to do in what is called the medical management of caries, or the medical management of cavities approach, which is the whole philosophy and science behind treating cavities without drills and fillings, and also the preventive care that involves xylitol to keep people from getting cavities in the first place, or once you've treated them, let's put them in that path and keep them from ever getting cavities again.
Let me ask a question more bluntly. Who is making money from this not changing? Because I think at the end of the day, when industries are making money with whatever it is, there's no incentive to change. And it seems to me, at least economically, that the ideas that you guys are promoting are way more cost effective than the status quo right now. So could you share a little bit about how much money are these dental practices making, and why would they want to change that model?
It is more lucrative to do the procedures with drills. It just is. Once treating a tooth with this medicine might cost upwards of, I'm going to say 10 times more lucrative, Ellie.
Yeah, at least.
At least 10.
If you're going to take a child into the operating room, then you get thousands. Is it up to $5,000 or more?
Oh, it's 10. It's 10. It's over 10.
So there's a huge financial incentive almost to make your life easier, do more work at one time, because you have a comatose patient and you can just do the x-rays and then go in and replace every filling and change everything and fill everything and crown and root canals. You can do this massive amount of work and come out with a $15,000 or more payment from it. Whereas if you're doing a few random silver diamine fluoride glass ionomer restorations, child will be in and out of your office in maybe 10 minutes, but you'll only have made $50 the most, something like that.
It's the difference is amazing. But the thing is that where could we save money? The state could save money because they're spending millions of dollars on hospital care. And I have colleagues that don't go into the hospital setting anymore. They don't have to. They're able to control this disease without all of that heavy lifting in the surgical operatory room.
So it's hard for people to understand, if I'm hearing correctly, this is the way that things have been done. People are trained like this in a very pragmatic way, because this happens in all sorts of fields. I remember when my wife gave birth the first time, which was almost 17 years ago, and her OB-GYN, who came from Harvard, was telling her that the way they were practicing medicine here in Texas was 20 years behind in the same country, right? This happens in all sorts of fields. So in one aspect, you have people who are practicing a procedure that hasn't had much innovation in the last 100 years. Then there's financial incentives for people to do procedures that are more costly, and to the detriment of children, now that you're saying this, which is the subject of this conversation, kids who are actually dying from anesthesia. There's a huge incentive for doctors to have those super expensive procedures. So my question to both of you is, and I'll start with you, Dr. Chris, what do you tell parents who live in the middle of the United States, who have traditional healthcare system, whose dentist is telling them that their kid has cavities, that there's too many, and that there's no way they can treat them unless they go under anesthesia? How do you provide them with enough information or tools so they can advocate for themselves?
If they have no access to a dentist that is aware of this information, then they would need to maybe find one or look for resources on their own. It's tough. If a dentist was wanting to use the drill or take me to the hospital situation, I would say, is there any other alternative? Because the one thing that the American Dental Association says is you've got to give them choices. It is no longer acceptable to say my way or the highway. So if they're steering you into the dental treatment for the amputation of tooth structure, or if they're steering you into the hospital for a deep sedation, that's not what the American Dental Association says. So I would just say, isn't it true that the American Dental Association recommends that you share with me options? Are there some options? And there are options. And these are options that the American Dental Association recommends. And so I'd go as far as to say that, and this isn't going to make me any friends in the dental world, but I'd rather save a life or two or a whole bunch of lives. Or I'd rather prevent people from getting unnecessary drills put into their teeth. That the vast majority of dentists are treating tooth decay incorrectly. It's an old-fashioned, archaic way. And why is it incorrectly? Because even the American Dental Association will say, you're not dealing with the bacteria. You're not killing the cavity-causing bacteria. You're just fixing the damage. But what if you can heal that damage? Once again, I go to the American Dental Association. They're saying that choose a non-restorative approach. Here's a medicine that can heal the damage. You don't have to get the drill out. So I would put it back on the dentist that the American Dental Association recommends a non-restorative approach. I would say, what non-restorative approach could we have here, doctor?
Dr. Ellie, what are some scare tactics that are the well-intentioned are being used to convince parents that they need to have these procedures, whether it's a drilling or putting the kid under?
People, they just don't believe there's another option. And the other day I saw a terrible situation of a 9-year-old who had a baby tooth with a very small, they sent me pictures. I'm not diagnosing because I can't from a picture, but it was a baby tooth next to a baby tooth that had fallen out. This is a child changing from baby teeth to adult teeth. Often the nerve will die, but it's such a temporary thing. Take the baby tooth out. It's already loose. Why would you put this patient on 10 days of antibiotics? I think that's equally atrocious because here's a child who's never had a course of antibiotics in their life. And the dentist is saying, we can't take that tooth out until we put you on a 10-day course of antibiotics. And all I said to the mother on the phone, because she was beside herself, because she's kept this kid away from antibiotics, has a healthy gut. What are we going to do to that digestive tract by giving the course of antibiotics for 10 days? Tooth isn't hurting. It's just got a little gum boil, a little bubble on the gum. And I'm saying, why don't they just take the tooth out? And the story was that the anesthetic wasn't going to work and it was too acidic around the tooth. This is the case in an adult tooth. If you have a really bad apical infection on an adult tooth, sometimes anesthetics don't work very well. You're trying to treat an anterior adult tooth that's highly infected. But a little baby tooth of a 10-year-old boy who's about to lose that tooth, just take, I said to her, oh, I wish I had an office right here because you could walk in, I'd have that thing out, maybe even without anesthetic. Sometimes you can just spray cold on a tooth and it'll be numb enough to pop a baby tooth like that out. And in the end, the mother, inspired by my resistance, said to the dentist, I will not take the course of antibiotics. I want you to treat this kid. I want you to take this tooth out and try not to hurt him. And it was all fine. Everybody left with a big smile on their face. All I can do is empower people to question, like Dr. Chris said, there is a website called mobdental.org. And the founders of that website ran a mobile dental unit. That's why it's called Moby Dental. And I would say to you, if you're a parent and you have been told to take your kid to the hospital, try and get in touch with Moby Dental and see if they can help you find a clinic or a contact or a resource. And if dentists are trying to learn more about what Dr. Chris is doing and they want to start an office like that, probably Moby Dental would be the place to go to be put in touch with educators.
Yeah, and there's a locator on that website. So you find somebody in your area. And people, I've experienced this my whole career, people will travel for the proper care that they believe in. And so that's a great service to have that medical management of caries locator. These are the dentists that will treat you as conservatively as possible without drills and with medicine.
And these people have been very successful. We have one gentleman in this group who I think has 3 clinics. And if a dentist is interested, there is a way, and to get in touch with Dr. Chris, because there is a way to set this up. If you're a new dentist coming out of dental school and you're a little overwhelmed by what it's going to cost you to set up a dental office, I would seriously, if I was a young dentist, consider talking to Dr. Chris about how much is it going to cost me to set up something where I don't need a dental drill and I don't need all that paraphernalia. Yes, you still need equipment, but it's a whole lot less expensive to set up. And if you're good at some patient interactions and you're a charismatic person, I believe it's the way of the future. And I would encourage, rather than go and work for one of these dental offices that's managed by business people, where you're just a pawn in a business game, do something exciting like this and get in touch with Dr. Chris, and let's change the way all these new dentists come out of dental school.
I'd like to bring back the focus on parents who are listening to this, who don't feel they have a lot of choices. And I will start with you, Dr. Chris, and I'll go with you, Dr. Ellie. What are the biggest misconceptions that are now widely accepted as truths, even though and you've seen hundreds of cases that of how people can get treated differently? So in the case of people who have children, what are some of the biggest lies that are told to them about the oral health of their children?
Wow. I would say that if we're going to get a little technical here, some people will say sugar causes cavities. You can eat all the sugar in the world you want. And if you didn't have the bacteria in your mouth that takes that sugar and spits out the acid on teeth to soften it and cause cavities, it's the bacteria. And the nice thing about xylitol, bacteria think xylitol, it is a sugar. It's a sugar alcohol though. And it destroys the bacteria. The bacteria can't metabolize the sugar that the other cavity-causing bacteria can. So there are sugars out there, but it's a sugar alcohol that the studies have shown that regular use of that, and I think you would like to say strive for 5 times a day. And over the course of 6 months, it is very difficult for the cavity-causing bacteria to survive because you're feeding them all this stuff that they can't metabolize. If I was eating plastic bags all day, pretty soon, that's not going to be good for me, and I'm not going to do very well. The bacteria in the mouth cannot metabolize that, and it tastes like sugar. It's delicious like sugar, but it also wipes out that bacteria and makes it darn hard, if not nearly impossible. I guess I can't say clearly impossible, but I'm just saying it is a game changer. And that's why I got so close to Ellie so long ago, because I'm thinking, like, if this is as good as it appears to be, and once you have patients that are using xylitol and you see the slipperiness of their teeth, the difficulty that plaque has to settle on your teeth to even cause the damage, you go, oh, I get it. This is amazing. And this is something that is not commonly talked about in dentistry. And then the other thing that parents think is, you got a cavity, you got to go get a filling. You got to go get it drilled and filled. That's not right. That's not how we talk in these circles. That is the last possible resort. And in my practice of 5 years, it's a never kind of a thing in terms of decay. And so that's what's mind-blowing for most parents, that you don't need the drills.
Dr. Ellie, in your perspective, what are some of these lies that have been told so many times also?
The importance of baby teeth is something that I think is not understood. People think they're disposable. And it isn't just that they keep the space for the permanent one, which is very important. And we're beginning to understand airway growth now, which is where you don't want to be taking out teeth unnecessarily if you can keep it and make the jaws grow wider. This is very helpful as we get older because we have more airway dimension if we can do that. So losing teeth is something I think every parent should try to understand. I didn't even take the wisdom teeth out of my final child because I got more and more aggressive about not taking out any teeth you don't need to lose unless you absolutely have to. And my grandchildren, the same. Nobody has a cavity. Nobody has a lost tooth. Nobody's going to have a wisdom tooth out. We are going to wait. And in the case of my youngest daughter, she was 34 before the wisdom tooth fully erupted. But if you've got a healthy mouth, wisdom teeth don't have to decay. Again, you can't floss back there. I get it. If you're relying on length of string, your wisdom teeth are going to decay. But if you're relying on the liquids in your mouth being healthy, which is how xylitol works, it dissolves in your liquid of your mouth, in your saliva, and it is basically washing your mouth, your teeth everywhere, coating them with this healthy sugar that is feeding good bacteria and getting rid of bad ones. That's a so much more effective way to clean your teeth. So parents who are having a struggle with toddlers, I hear these horror stories of parents holding a toddler down to floss their teeth. I mean, while I've had this argument with lots of people about flossing, and I won't start that here, but it's so unnecessary. If you just do the best, keep toothbrushing fun for children, develop the late night habit in the bathroom. I always gave my grandchildren an electric toothbrush that plays a fuzzy tune or something, and I would dance to it and they would laugh. And we had such a good time. They still remember it. But 2 little xylitol mints before you go to bed at night. Change everything, clean the mouth that way. The second thing is that sealants, which are a plastic treatment, I do not believe is preventive. If you have no disease, you don't need to block the grooves of teeth preemptively. There are situations where sealants would be helpful. There are definitely places for sealant to be better than a filling. But to be trying to seal the tooth of every child in America, which is when certainly not that long ago, the goal of the American Academy of Pediatric Dentistry, I would say that's a terrible thing because you're putting a plastic unnecessarily in a child's mouth. I wouldn't want it. And I believe the healthy bacteria in those crevices are far more protective and defensive. And it is a healthier, natural option. They've been doing this in Finland now for over 60 years. It's so passé what we are doing. And same thing with, as Dr. Chris feels about fillings. I feel preventive treatments should be out. Preventive strategies are the way to go.
Dr. Chris, what do you feel are the most effective strategies for parents who are actively concerned about their children's oral health, who want to prevent even having this discussion with their dentist about what are the practical steps they can take to have either eliminate or greatly reduce the risk of these procedures, whether it's drilling, whether it's sedation, anything else that is costly and traumatic for children?
Okay, in the dental office, there's care that we can offer that would involve this silver diamine fluoride as the teeth are up, painted into the grooves, and it'll go down into the tooth structure and kill the bacteria that's starting to form in those areas. So it's a knockout punch early on. And so we can do that. And then if there's any microscopic little spaces in the teeth or if there's holes in the teeth, definitely use these glass ionomer fillings that are also healing and will make it easier for the teeth to keep clean and also continue to put minerals into the tooth to make them more resistant to decay. So the wonderful thing about a glass ionomer is that it fuses to teeth. So in dentistry, we keep thinking like, when I learned how to do dentistry was always we had to cut into the teeth so that it would mechanically hold a filling. And we moved away from that to some extent with bonding and such, but they're still talking about going in and removing some tooth structure that may be decayed. But now we know we can treat it with medicine, and then we can close it up or seal that medicine in there with a glass filling that can float. You paint it over the grooves of the teeth and over the tooth, and it'll fuse to the tooth structure. And it fuses so well that it becomes one with the tooth structure in a layer that is called the cavity resistant zone. It's part glass ionomer and it's part tooth structure, and they fuse together. And so that area is very resistant. So the problem with sealants is that they can leak over time. It's just a different method for retaining it. And oftentimes we see cavities forming under sealant fillings. And there are some people that have some issues with the plastics that are in sealants, and that's a concern as well. So I don't recommend sealants, but I do recommend the glass ionomer coatings, coverings. You could call it a sealant if you want, but they're down there in those microscopic areas that are still going to be prone to collect plaque. If even down in the black, dark grooves of a tooth, there are areas there that they could use a little filling in. And so the glass ionomer will fill those areas in, make it easier to keep the tooth clean, keep it sealed so that it can't get decay underneath it. And the other thing that nobody knows about glass ionomer is if there's a cavity in between the teeth where the floss might go, glass ionomer on the top of the tooth actually helps prevent cavities in between the teeth. And there are studies that show that as well. So to me, the best approach, the knockout punch is treat the erupting teeth with the silver diamine fluoride, and then get a glass ionomer as needed over that to keep the medicine inside the tooth and create that cavity resistant zone. And that's without shots, that's without drills. And if they're following Ellie's care and they're using all the home care products and using xylitol daily, they're going to probably be in pretty awesome shape. Even if they knocked out a part of the glass ionomer filling or something, it's so easy to put a little more back in there. We just put it on our fingers and we smush it onto their teeth. It's so kind and simple and beautiful that it should just be done all over the land and all over the world.
I have a question for Dr. Ellie, because I often think that humans are poor at understanding risk. And we see it everywhere, whether it's someone who is buying a lotto ticket and doesn't understand the odds that are like completely against them, or someone who is deadly afraid of flying, even though it's way safer than driving. Or we see examples where people are texting while driving, even though it's like worse sometimes than even drinking and driving. So our brains are not trained to calculate risk. I think that obviously the ultimate example is having a fatality, putting a child under. But can you speak to some of the risks of having traditional procedures on children, whether it's the drilling, whether it's the type of chemicals they use? Can you speak a little bit about that?
I am concerned about putting plastic in children's mouths. I've done it. I did it. I did it to my own children until I woke up one morning realizing, what am I doing? Why am I doing this? And had to turn around. And it's the same thing with taking out teeth. I subjected my children to early orthodontics, taking out a lot of teeth and condensing the jaw into a smaller shape. And now I see that is the worst thing. Why didn't we expand it to open up the sinus, because everything grows together. It's hard to imagine, but your face grows. Keeping wisdom teeth will allow your jaw to actually be taller and slightly longer, because the bone will continue to grow, and that will give you a bigger, wider jaw. It just is. And the bigger and wider your jaw, as you get to my age, you'll be very thankful, because you'll be less likely to be needing the CPAP machine and the sleep apnea stuff happening. And you'll have more oxygen to your brain. And we get into the oral systemic stuff here so quickly. The mixture of ongoing, never-ending fillings. Dr. Chris mentioned. So you put it in about 13 years later. So that child is now 23, out of the parents' insurance. It's got decay around the edges because the plastic is a plaque magnet. So now at 23, that kid actually has decay around the edges of the sealant, but they don't have insurance. They're off their parents' insurance, so they don't do it. And they've just started work and they've been out of college, and they probably got horribly infected kissing people at college because it's a transferable disease. And so here's the young adult with a mouth waiting to be a disaster. They don't realize that 50% of Americans at age 30 have gum disease, and the gum disease is preventable. Again, if you don't have plaque, you won't have gingivitis. Gingivitis opens up the space into which these special they're not plaque bacteria, they're different. These really aggressive bacteria go into these little spaces. And so here's the 23-year-old already got a plaque magnet, got decay around the 4 sealants or 8 sealants that he had or she had, now developing gum disease early stages. Eventually gets the job under control, goes to the dentist in their 40s, shocked to find they have 8 or more substantial cavities, and are told they need periodontal deep cleanings because they've got pocketing. And this isn't the end of it, because they have all of that corrected, only to find that 15 years later, those 2 surface fillings are now leaking even more. So now the tooth has died, and they'll need a root canal and then a bigger crown, and then the root canal maybe doesn't work. Then they've got an implant, and the whole thing is just on a downhill escalator from the minute they had the sealant done as a child. I'm delighted to say that my 36-year-old has never had a dental treatment. And that puts her at 36 in such a much better place to go through life without the need for dental treatment. I'm not saying she won't. And I'm not saying don't go to a dentist. I am saying go to the right kind of dentist that wants that outcome.
The business model of dentistry is drill, repair, or repair and replace. In other words, we know that any filling we might do for somebody in the old traditional way of dentistry, it's not going to last forever. We'd like to think it would. And some of us are idealists, and we hope we can get everybody doing perfect home care. And there are options to really do well, but it's not a guarantee. And we know it doesn't get rid of the tooth decay bacteria. And so I say, do not drill that cavity until you can get to a dentist that practices the medical management of caries, which once again is the medical management of tooth decay. So you can have an option. You deserve an option, and you may not be getting those options, but just what Ellie said, it's a downward spiral. You get your first sealant or maybe your first filling, and in a number of years, replace, repair, replace. And they get bigger as they get replaced over time. And then the next thing you know, it's so big you crack a cusp off, and now you need a crown. Or now there's been so much trauma to the nerve, you're going to need a root canal. And root canals aren't always 100% effective, and maybe you have to have the tooth pulled one day, and now it's an implant or a bridge. To think that we can stop the downward spiral of all that reparative care is, and so that's why sometimes the message isn't getting out there like it should. But I would say this isn't going to go away. This lane that Ellie and I are talking about, it's not going away. It just may take some time for it to become more commonplace. But that's why we're here talking to you today, Cristian, because this message needs to be heard. And I would say, find somebody that practices the MMC, the medical management of caries, or the medical management of cavities, because there are approaches that don't require the drill, don't require the shot. They're going to keep your beautiful teeth intact for maybe a lifetime. Look at what Ellie has experienced with her kids. Committed that my grandkids are never going to have a drill put to their teeth, and they've been getting this care. We've used the SDF on them. We've got the glass ionomer seals on them, and to go even deeper, we're now working airway and arch development and all the things that are healing and helpful.
Let me just drive this point because this is so important. And I just want people who are listening to this to really understand what you're saying. So what you're saying basically is that these seemingly benign procedures that are not benign, that are costly, that are often traumatic, because I know people that are in their adult life, they're terrified of going to the dentist to this day, that these things that we're doing for our children, where we think we're being kind and we're spending a lot of money and we're traumatizing them, are the beginning of a process of decay, not just for teeth, but for gum disease and for a series of procedures that they will have to endure as a result of our lack of understanding of what we were doing in the first place. With that in mind, before we close this conversation, I want to leave people with hope, and I want people to understand what is possible. And I know that you talk a lot about reversal of cavities, reversal of gum disease. Can you share some examples that a normal dentist would have given up or done a horrible procedure that you've been able to take care of with natural processes?
The most wonderful ones, and I have actually put it up on YouTube as a testimonial and also on TikTok, was a lady who called me up. She had a Down syndrome child. And with Down syndrome, you have a bigger tongue. The tongue is intrusive. It's bigger than it should be. And it pushes teeth forward. The tongue is like an orthodontic appliance in the middle of your mouth. And in the old days, Down syndrome children never lived as long. Today, they live longer because their medical conditions are often better controlled. And this child was in her 20s. And the mother had been told that these lower front teeth had lost 50% of the bone. The gum had gone down and the bone had gone down, and the teeth were pushed forward by this big tongue in the child's mouth, and that she should have these 4 anterior teeth extracted because there was no hope now. They were loose and they were protruding forwards. And she'd been to 2 or 3 dentists to have that, to try to save them, and they all said the same thing. I had just published the first edition of this book of mine, Kiss Your Dentist Goodbye. And she read it, and I was doing counseling in those days. So she called for a half an hour consultation. And I told her about this complete mouth care system of mine, which is 3 mouth rinses, gum massage with a fairly vigorous, what I call a flossing toothbrush, not flossing, but brushing it to actually stimulate stem cells and lymphatic drainage and circulation in the gums on the inside and the outside of these already loose teeth. And the mom was committed to this and did it. And I never heard any more. I was shocked 11 years later to have a phone message saying, "Hello, Dr. Phillips." And she wanted to talk about her daughter and how her daughter had just been to the dental office. And the bone was now completely 100%, no pocketing. Teeth were firm as rocks. She never had them out. And I know, had she had those 4 teeth taken out, it would have been like dominoes. Everything would have moved forward. The tongue would have pushed the next one and the next one and the next one. And we know that the majority of Down syndrome kids, by the time they're 30, have dentures. I used to do the dentures at the University of Rochester for the Down syndrome children. And I am so delighted that this child now 11 years later has nothing but a healthy mouth. And it wasn't difficult. She didn't have to even go to the dental office. She dealt with this with a committed mother who got herself on the program, learned how to do it. Then she took it to the child. And I would say that to parents, realize your mouth health is being shared with your kids. You can't just put it on your kids. You have to get your own mouths healthy. And my complete mouth care system is a quick fix. You may not like fluoride, and you may want to know. If you want to know the whole story, pick up the 2025 edition of Kiss Your Dentist Goodbye. It explains why I don't know any other way except my complete mouth care system to stop and control this disease. But if you do it in your own mouth, little children should not use the complete mouth care system. I don't put fluoride into a child's mouth until they can rinse and spit and have control. I don't want them ingesting toothpaste, drinking fluoride mouth rinse. We can do it with xylitol and Dr. Chris's methods prior to that. But once they get old enough, I am a fan of rinsing with some fluoride toothpaste because it strengthens everything. And if you really want to turn your mouth health around, I have a solution for you. You just have to do it.
What really made me become extremely committed to staying in this lane and doing this healing care was my trip to Bolivia. Like I said, we saw hundreds of kids there, and I'll talk about a couple in particular because it's beyond what I would normally see on a regular day. I've seen things close, but a typical day in my office, I'm not going to see a 7-year-old child with 26 areas of active decay and in pain. So what made me a believer is this child that came in pain with all these areas of decay, which you see when you even look in their mouth. I just see all this dark decay and missing portions of the teeth. And to think that we could just paint on the medicine, the SDF, and seal it with a fluoride varnish and do that 2 times and see them 6 months later and all the areas of active decay were halted and the child was not in any pain. That made me a believer. And I'd been doing it myself in my office, but not in as extreme cases as that. The other beautiful thing was for the special needs kids that don't have a hard time getting traditional care in an office, and maybe they're more likely to be sedated, but we didn't sedate any of the special needs kids. And especially Bolivia, they'd been bounced around to a number of clinics and nobody wanted to see them. And we were able to use the topical medicines very kindly, very wonderfully. It was just a wonderful experience and help them with their care as well. And the tears that came down from the mamas of these children because they just had no options. Nobody wants to see my baby. And we welcomed them with open arms. And I do that, go to special needs patients' homes. I go to the nursing homes and deliver this kind of care to the residents of the nursing homes because they can't get out. It's so hard to get out to the dentist. I could go on and on, but this is such a godsend for the world of health that I'm just so fired up, and I can't not talk about it in an excited way because it's here to stay, and I've seen it. Another one of my favorite cases was I prevented a 55-year-old man who was cared for. He was paraplegic. He had a brain injury accident, tube fed, non-responsive, but broke a filling. The team wanted to take him to the hospital for the deep sedation. It's a default kind of reaction. And when I heard about that, I said, I bet I can come up there, go to your home. And I have a heart for the parents. I've been blessed with some healthy kids. And my heart goes out to the struggles of the parents, that whether they're in the underserved category or they're taking care of a special needs child. I want to be there to support them. And this philosophy and this medicine is just tailor-made to help these people. And so I drove up to the home where these elderly parents were taking care of their son, tube fed. He had 2 nurses come in, one in the daytime, one in the nighttime. And I walked into that home. I set up, I put the little medicine on the tooth, mixed up a little of the glass ionomer filling. I was in and out of there in less than a half an hour, no shots, no drills. And it's just beautiful and done. And the mother was in tears. And I'm not saying this like I'm any special guy, but I didn't even want any money for that. I need to show my world of dentists that this can be done. And anytime you have somebody that's either has a developing brain as a little baby or has had brain damage, or deep sedation is a risk. We're not sure what that does to the brain. So if we don't have to put people in deep sedation, let's not do it. Let's choose a kinder, more humane medical management philosophy of care instead of the automatic default. Nope, send them to the hospital, deep sedate them. That's going to cost tens of thousands of dollars to the state and put the patient at risk for who knows what it does to their brain, especially if they've already had brain damage, or if it's a little child whose brain is developing. Your brain is forming till you're age 5, and then it continues to form, but it's 90% formed by age 5 or 6. So any deep sedation before that, don't do that if you don't have to. We have methods where we don't have to do it. We want to reduce the risk of a deep sedation in the hospital for the children that have died in the last number of years, and there's dozens of those children. That just breaks our heart. But let's keep all the babies out of the hospital as best we can, and not put their developing brain at risk, because nobody knows what that deep sedation does to the developing brain. So I'm just saying, come on, everybody, let's get on this. It's a kinder, gentler, more humane way of doing dental care. Never in my wildest dreams did I think this was something that was out there going to be available during my career. And at the tail end of my career, I'm going like, hey, I want to start a brand new career. I don't want to leave this space. There's too much to do. There's too many people to teach. There's too many babies to save, and elderly. It's good for the youngest of the young and the oldest of the old and everybody in between. So that's what I'm doing here. And I couldn't be more excited or happy to share that news and try to do my little tiny bit along with Ellie Phillips, who was one of my first mentors in this whole non-invasive space with all of her. She's my xylitol mentor. And I'm so blessed that we hooked up and got all together on helping create the American Academy for Oral Systemic Health. So I have a couple websites. thedrillisgone.com. Also, my dental office is called Victorious Dental. So that has its own website as well. Check them both out. But if you want to see some clippings and some information about doing drill-free healing care, either website will be fine.
Dr. Ellie, where can people find more information about your book?
I really want to promote the mobydental.org website, because I actually try to help them, and anyone who wants to. I often have people say they're grateful for the free advice that I've given over many years. I feel supporting this website is a great way for us to support the future of dentistry. So if there's somebody out there who feels very strongly that they were helped over the years, unknowing to me, I know I've been asked this, what can I do for you? How can I pay you? Consider visiting mobydental.org and maybe help support them. My own website is drellie.com, drellie.com. But I would encourage, I'd like to promote, not for the sale of my book, but in that book, I have described this. I have described what Dr. Kammer and I have done and what is happening now, and these organizations, and what this atraumatic medical management of caries, cavities is all about. So if you want to read about it, I think the new edition, the 2025 edition of Kiss Your Dentist Goodbye, would be my recommendation.
Thank you so much to both of you. I hope this has been helpful to those of you who are watching this. If this has been helpful to anyone who's watching, please consider subscribing and please consider sharing this information, because we all know parents who need to hear this. So thank you so much, and we'll see you the next time.